Good afternoon. Got spectacles on, have notes, ready to go. Presumably, one would think. This is just to keep me on track so that I cover all the points that I want to cover and don't meander about and off the beaten path too far, which you know I'm prone to do. Anyway, got an email from a brother Ryan, and Brother Ryan is on testosterone replacement treatment. He's on 200 milligrams a week, which, you know, some people are going to say, well, that's kind of high for TRT, and other people are going to say, because they're not on genuine TRT, they're going to say 200 milligrams a week is nothing, is too little to do anything. And, yeah, that's not true for sure. It's definitely not too little. That's absolutely not true. But as far as it being too much, it's a hugely individual thing. I'm not going to make a huge video about why, but it legitimately is. It legitimately is. And that would be a whole topic in itself to try to take apart and examine. So let's just talk about this problem, this current issue at hand. He went to donate blood. He hadn't donated blood for a while. He waited too long. Went to donate blood. They wouldn't accept his donation because they said that his hemoglobin is too high. His hemoglobin is too high, so they won't take any blood from him. So he's kind of concerned about this, so what should he do? So number one, the first thing that I would probably do is cease and desist. I wouldn't want to make the matter worse. And I would check my blood pressure, absolutely check or get my blood pressure checked. And I would want to repeat reading twice. You know what I mean? Take it once, see what it says, then immediately take it again, see what it says. If you're getting all these variable readings, take it a third time. Until you feel confident that you've got a reasonable idea where your blood pressure actually is. And the reason I say that is because with me, it's kind of difficult to get a decent blood pressure read. And sometimes if the cuff isn't large enough, the nurse will try to take it on my forearm, and then it's hit or miss. You know, when they take it up here, it's hit or miss, you know, because it's not actually level with my heart, it's lying down here. And you know, and the surgeon that repaired this tendon on me most recently, he actually told me just the other day, he said, we have a hard time getting accurate readings that way off of you guys. He said, because when you have all that muscle, it is very difficult to get a reliable reading. You take it 2 or 3 times and try to get, you know, a repeatable reading. It can vary wildly sometimes. And that may not always be the case. Sometimes it's not the case, but it has at times been the case with me. So do what you got to do to make sure you're getting a good read on blood pressure. If your hemoglobin or your hematocrit is high, you probably have high blood pressure. You may, with this high hemoglobin, you may have high blood sugar. So are you tracking that? I would wonder. And now that you know the hemoglobin is already high, you may be able to manage a lot of these other things are being caused by the high hemoglobin. So you may be able to deal with the hemoglobin, bring that down, the red blood cells, bring that shit down, thin the blood, and that may take care of all these other things. First obvious thing is, you know, if you're on any kind of testosterone or anything like that, you need to take an aspirin daily. You need that baby aspirin every single day, 1 baby aspirin every single day, and of course consult with your medical professional. Don't just take my advice. Believe it or not, I'm not a doctor, but I'm just telling you what my experience has been. Baby aspirin every day. I routinely check my blood pressure, and I have a good feel for when my blood gets thick. When my hematocrit level gets too high, I will start to feel lethargic. I can actually feel that when my blood is getting thick. So what exactly is this? Why, if we're talking red blood cells, why do we have two different tests there? Why are we talking about hematocrit and hemoglobin if both cases we're reporting an instance of a high red blood cell count or higher than normal red blood cell count? If that's the case, it could be lower as an anemia. But right here now, I'm only going to discuss higher. That's what my intent is. I'm leaning in that direction because I'm associating it with you're on TRT or more, and you have these high counts now. You're wondering what the hell's going on. So first you have to understand what's going on with blood, what makes up your blood. So blood is made up of solids. The solids are red blood cells, white blood cells, and platelets. Those are the solid parts of the blood. Then also blood is made of a liquid. The liquid part of the blood, the liquid portion, is plasma. is plasma, right? So are you starting to follow yet? So you can have a case where you get this high hemoglobin count, and it can be because you have a low blood plasma level. Yeah, you understand? Such as in dehydration. If you're dehydrated enough, you're going to get high readings in these red blood cell measurements. You're going to get high readings because not that they themselves are high, but in proportion they're high because the plasma, the blood plasma level is not up where it should be because you're dehydrated. So in a lot of instances, if I want to lower this thing, anything doing with a red blood cell count, blood getting thick, right? If I want to lower it, number one, ask yourself, how well hydrated are you? Start drinking more water. Get better hydrated. This is my advice. This is what I would do. Get better hydrated. Next, there's a number of ways you can do that. You could drink more water, or myself, I would drink more water. If I couldn't donate tomorrow because my red blood cell count was too high, and that has happened, then I would drink more water, try to get really good and hydrated, make sure I'm taking that baby aspirin every day, try and keep that shit thin to prevent unnecessary clotting. You don't want blood clots, right? And I would go down to the clinic down the street and get a vitamin infusion. There are a number of things you can do. I can actually get a hydration, infusion, IV bag shot right in me. Because again, I'm putting in liquid. It's not gonna last long. It's not gonna last long. My body will sort itself back out, but it will bring that hematocrit down because now I've cranked up the amount of liquid in my body, in the relationship of what's in my bloodstream. So now it's as if it's just like having more plasma for a while, and so proportionally that red blood cell count is going to be lower. It's going to come down. These can indicate other problems. These high red blood cell counts can indicate other issues if you're not on TRT, which, listen, I know about it as much as I need to know about it for me to stay alive. So if I'm not on TRT, if I'm not on any testosterone, I'm good to go. I don't have problems with that. Those problems I create in my own body by using testosterone. And I'm not using a lot of testosterone, so I would tell you right now, in my older age now, 250 milligrams weekly, and this is real shit. This is no bullshit shit. 250 milligrams weekly is absolutely enough that if I don't donate blood regularly, routinely, and I don't take some of these other measures, and I don't stay on top of it and watch what's going on, absolutely my red blood cell count will get too high and my blood will get too thick. Even on that, what most people might consider low amount. Again, it's not a low amount. That amount, 250 milligrams, 200 milligrams weekly, it absolutely destabilizes your body. It absolutely does. It can incite all kind of markers that you don't want, cropping up. So you got to stay on top of it. And then most of the time, like right now, it's day 11 or 12, rather than every 7 days. Today would be like my 11th or 12th day that I haven't had my dose. I haven't had my dose. So I don't even, I'm not steadfast to make sure it's every 7 days, even the 250 mg. So it's not like, I know people have a hard time believing it. But this high red blood cell count can indicate other health issues. It could be from heart failure, COPD. It could be from liver cancer, or again, dehydration. Cancers, there's all kinds of cancers that can cause it to happen. It can be an indicator of, and there's several other diseases that it can be an indicator of, just one indicator. But again, if you're on any kind of testosterone treatment at all, that's the first place to look, the most obvious place to look, right? Smoking is one of these things. In an adult male, 42 to 54% is normal, and in an adult woman, 38 to 46% is normal. One buddy of mine, he's always about 44. He likes to stay around 44%, and he's figured out how often he has to donate at his consistent dose, to remain about there. He does a great job with that. He's a little bit younger than me. Myself, they allow 54% at the top end of an adult male. I say that's too high for somebody that's on testosterone. If you're not on testosterone, maybe that's okay, but if you are on testosterone, that's too high. In my opinion, for me it would be. I wouldn't want it that high. Mine has been as high as 59, which is freaking horrible. You know, so they allow 54. Mine was 59. They wouldn't let me donate one time because of that. Now, it's been a while because I mind, you know, I pay attention to what's going on now. I manage what's happening. So, you know, I let it slide. But as you get older, sometimes you got to stay more on top of things. For an older adult male, I'm going to say, if you can keep it below 50, you're awesome. And in some, you'll find some places where they'll quote 51%, 52% is your top. You know, they won't give you all the way to 54. Me, I'm thinking if you can stay below 50, you're fucking good. So why, if the blood's too thick, is it bad for you? Well, if your blood's too thick, you probably also have high blood pressure. Because imagine it this way, oil in your car, all right? Say your oil pump's going bad, or you got journal is going bad, or some kind of something going on that you have low oil pressure, okay? You have oil pressure, but it's low. Maybe it's so low that the oil pressure light stays on all the time, and it's not the sending unit or sensor or whatever, right? That's a true reflection of the oil pressure. Maybe the light stays on when it's at idle. Well, if you just wanted the frickin' light out, you could drain the oil out. Say you got maybe, I don't know, 2050 in that vehicle. Drain the oil out, and you could stick a heavier straight weight oil in there, and that's gonna keep the light off more than likely. I mean, I've seen it happen. Is it a good thing to do? No. Is it a thing to do that will never cause a problem with your car and it's a safe thing for your engine? Absolutely not. It's not a good thing. It's a bad thing for your engine. It's not anything to do. I'm just saying. And it's the same thing with the heart. The heart is not designed to be pumping around anything that viscous and thick, right? So picture it that way. Okay, so hemoglobin test measures the amount of hemoglobin in your blood. Hemoglobin is a protein in your red blood cells, an iron-rich protein. That's where the iron is. Hemoglobin in a protein in your red blood cells that carries oxygen to your body's organs and tissues and transports carbon dioxide from your organs and tissues back to your lungs. And this is why in some cases, if you're a little bit high, if you're young and healthy, that's okay, a little bit high. And I'm not saying it's okay, I'm not a doctor. I'm saying some doctors of that opinion, just Google and read some of the information that's out there from the Mayo Clinic and other sources, that some are given a little bit more of an allowance to say, okay, if it's a little tiny bit high, that's okay because you're going to have a little bit more energy, you're going to have a little bit better uptake and transportation of oxygen and all these other things. But in an older person, it's never a good thing. Nobody thinks it's a good thing in an older person. HbA1c, or just A1c, refers to your percentage of hemoglobin with glucose attached to it, which means it's a vital indicator for pre-diabetes or diabetes. Okay, so if you're looking to lower it, you can reduce it with diet, exercises, changes in your diabetes management program. So there's another interesting thing. You got to sit up and say, this is why that a man should know all these markers. You should know what your blood sugar runs. You should know what your blood pressure runs. You should know what your fasted blood sugar level is first thing in the morning up out of bed. You should know. This is your responsibility. So if it gets out of hand and you're blindsided by it, it's your fault. You know, you can get away with a lot of shit when you're younger. When you're older, you really need to be mindful and mind the store. And then again, if you all of a sudden you've got a little bit of a problem with high blood sugar that you didn't used to have, and now you do know that your red blood cell count is high, again, it's another issue. Same thing with the blood pressure. It could be possibly alleviated if you get that blood thinned out, if you bring down that hematocrit or bring down that hemoglobin. But there are things you want to follow up on, obviously, with a medical professional, because again, that's not me. Adult males, 14 to 18 grams per deciliter. Adult women, 12 to 16 grams per deciliter. Men after middle age, listen to this. Men after middle age, 12.4 to 14.9 grams per deciliter. Okay, so as you get older, they don't like to work you don't want to work your heart that hard. They don't want to work everything that hard. So there you go. Younger, you might be a little on the higher side. You might be a little more energetic. It might you might not really pay any negative, cost for that. But as you get older, we want to err on the side of caution, absolutely. At least that seems to be the findings of the medical community. Again, I'm not a doctor. So what can you do about it? Well, first and foremost, if you're on gear, if you're on testosterone replacement therapy, you can cease and desist. This is the first thing, is to look to that. Look to that. Make that go away, and then see what it does. Quit cigarette smoking, transfer to a low altitude place, drink plenty of water, cut back on your iron intake, avoid iron cookware even, reduce your intake of vitamin C, donate blood, avoid foods rich in iron and iron supplements. In cases where the doctor really feels it's necessary, you can have what's called a phlebotomy treatment, which is when they're going to pull out, it's kind of like a donation, blood donation, but they're going to pull out a set amount of blood. They're going to pull that out, and then as your body replaces that with fresh blood, it's assumed that now that red blood cell count is going to be lower, that hemoglobin and hematocrit. The doctor may want to do this a couple times, and that has to be coupled along with treatment and things like that you're going to do, lifestyle changes, whatever it may be, dietary changes, more exercise, cardio, better hydration, things like that to prevent this from happening again. It's just kind of a Band-Aid unless you're actually taking other measures. Like, how did it get there to begin with? Again, something might bring it down for now, but what's going to happen later, okay? So again, for our interest, how it corresponds to this lifestyle, our lifestyle here, if you're on testosterone, even just replacement amounts, look to that first. But get that dealt with, and then look and see what's happening. If it were me, and I got turned away from donation, if it were me, now where I go, if I'm turned away twice within, I don't know, a certain period of time, it's a pretty lengthy period of time, I can't come back. So I would go, and if I was too high to donate, like I said, I would make sure I got my baby aspirin on board. I would turn up my cardio. I would make sure that, again, that I'm well hydrated, and I would stop putting anything in my body that might be causing this. Okay, back off the iron supplementation, watch eating foods that are high in iron, maybe avoid them for a little while, because you have plenty of iron in you, if you got a hemoglobin issue. And I would go and have an infusion, have a vitamin infusion, have a hydration oriented infusion at a treatment center, at a clinic, which I get them done, I have them done. So if I couldn't donate tomorrow, I would go get a hydration infusion, and I would have my baby aspirin. And to be honest, for me, if I was only a little bit too high, I would go back relatively soon, while it was still lowered from the transfusion, and get some of that blood out of me. Other options are go see your doctor, tell him exactly what happened, and let him run the tests and investigate, and maybe even recommend a phlebotomy. And that'll absolutely, if you can get a phlebotomy is much more superior for bringing all this down than just donating blood. But here, in most cases, it's not as simple as to go and get a phlebotomy ordered, because a lot of places require you to have that prescribed or recommended by a doctor in writing, right? That kind of an appointment. It's not like you just walk in and tell them you want a phlebotomy. If you can where you are, then that's a huge boon. That's a huge boon. Anyway, foods to help lower it. Leafy greens, kale, spinach, broccoli, berries, blueberries and strawberries packed with antioxidants and fiber, and berries have relatively low glycemic index. Chia seeds, quinoa, Greek yogurt, high in protein, low in carbs. Greek yogurt can help stabilize blood sugar. Cinnamon, turmeric, nuts, rich in healthy fats, protein, and fiber. Nuts can help control blood sugar levels. Avocado, salmon, fatty fish, rich in omega-3. Yeah, let me throw that out there. If you're not taking fish oil as a supplement, take fish oil. That's going to help. There's a lot more. Garlic, olive oil, green tea, vinegar, flax seeds, garlic, that kind of thing. So along the same lines as if you were trying to control blood sugar and you were trying to watch out for that. Shit to avoid, common sense. There's going to be no sugary bullshit. You don't want a bunch of sugary shit. Sugary beverages, soft drinks, juices, energy drinks, sweetened teas, anything causing rapid sugar spikes. When I take my Carbolin and come down here, I blow that shit out immediately. I crash my blood sugar with the workout because the workout's intense enough to do that, and the amount of Carbolin I'm taking isn't beyond the point where it's achievable for me. Let me fix this fucking camera. All right, so anyway, you get the idea. Fast food's no good. Pretty much all the shit that you would worry about if you had an interest in trying to control blood sugar, if that was a problem with you. And you can almost assume that is kind of semi a problem and treat it in the same way in some regards. And it's certainly going to just benefit you. It's not going to be anything that's going to be negatively impactful to your health anyway. So there you go. Can't donate blood, turned away. Get well hydrated. Whether you're chugging down water, you're drinking more water, or you go to a clinic and you get a vitamin infusion or a hydration type of infusion, if they specifically have that. You're just putting liquid in there. That's basically what it is, to dilute the shit. And then get the blood out of you as quick as you can. And this is if it's high because you're on gear. If you're not on gear and these markers are high, don't listen to any of the shit that I'm saying. Just take this as a fucking huge warning. Follow up, get with your medical professional, your doctor, whatever, and find out why and what's going on before you end up pushing up daisies. Because something's wrong. Something's really wrong. Much more wrong if you could just blame it on gear, Meaning gear, you can just stop the gear, you know what I'm saying? All right, that's it. And when you resume your resumption, once you get some of this blood out of you and you're back down low, then you have to play away with how frequently you can donate. If you can donate once every 50-some days, whatever it is, I would maybe think about doing that if you've already had a problem, that problem exists on the amount that you're on. I would think that most people are going to be okay if they follow that kind of procedure. That's it. Hope that was worth something to you. Again, YouTube, I'm not giving medical advice. I'm just explaining what I would do, what I do. And I'm telling you guys, I'm just a fucking idiot. I'm not a doctor. All right, you guys take care. Have a great day.